The Kidney Cancer Association was founded in 1990 by a patient, Eugene Schoenfeld. He was a PhD, a professor at the Medill School of Journalism here in the Chicago area. And in 1990, there were no patient organizations, no treatments for kidney cancer, really nothing that could be done for his disease. As an intellectual and with a background in technology, Gene thought, how can I use my assets to do something with this? So he, a few other patients and physicians got together around his kitchen table and formed the Kidney Cancer Association back in 1990. They worked to get interleukin-2 fast track approval for kidney cancer, which was the first thing that patients had, that if they were able to take the drug, then they might have a chance at being cured by this, or at least living longer term. Over the years now, we've seen a number of therapies approved for kidney cancer patients. I think that, in Gene's wildest dreams, he would, never believe that only nearly 25 years now, where we've come. We focus on helping to support research, so we do it through the American Urological Association and the American Society of Clinical Oncology, supporting Young Investigator Awards. We provide education, so educational resources, patient support group meetings, patient conferences throughout the US and Europe, that patients come talk to one another, hear from the experts, talk about the disease. We also do physician education, so we have this symposium here in the US every fall. We have a symposium in Europe every spring. Some of these are also video CME accredited programs that we'll offer to the physicians. And then we also serve as advocates, so helping patients to get access to therapies, maybe working with insurance companies, and just other issues that they might have dealing with this disease. We consider ourselves a global organization. As I had mentioned, we now do the symposium in Europe every spring. This April we'll be in Lyon, France. It'll be our 10th European International Symposium, and so we'll bring doctors from all over to come and to learn what's going on in the disease, to have an opportunity for some dialogue and debate. Every time that we're in a different country in Europe, we'll have our primary publication for patients. We have kidney cancer translated into the language of the region. So right now, this publication is available in 13 different languages on our website. So we try to push that out to patients using social media, trying to keep the relevance of the Kidney Cancer Association high on different country search engines, and working with the doctors and nurses in these countries to help them disseminate the information to their patients and being a resource for them as well. We've seen, some great advances with the targeted therapies that we've had the last few years, and now we're hearing a lot about the immunotherapies, and we're hearing about approvals with other disease states, and hoping to see that in the next 2 to 3 years that we'll have a few more drugs approved for kidney cancer. I think the exciting thing for us is that while for such a small, tiny disease, we're so lucky that there are at least some options for patients, that there's still a huge interest from physicians and from industry to keep working to find a different solution. So not just coming at it the way we have been, but looking at it upside down, backwards, forwards, and seeing how we can find a way to really beat this disease and give patients a long-term survival. Obviously, there's different forms of kidney cancer, with clear cell being the most common. I think that so many of the drugs that we've had have been, specifically for that type, and now there's a lot of research being done for some of the rarer subtypes that we get patients that contact us and want to know if they can join a trial to see if the drug might work for their subtype. I think just making sure that we continue to educate physicians as well as the different types of cancers that are out there, or types of kidney cancer that are out there, and letting patients know that there are people that are researching it and that there are options. And we're huge proponents for clinical trials. I think one of the challenges as you get this far along with treatment for a disease is now there's so many options for patients for approved drugs that they tend to think, well, now I have a cure, I don't need to do a clinical trial. But the only way that we ever really will find that cure is by continuing to do research and trials. So we are constantly letting patients know about trials that might be out there, that there are so many that they can do an approved drug with the drug that's on trial, so that they're guaranteed something that might be helping them. And I think just educating on what a trial really means for patients and for physicians. I think we've been fortunate that since our founding, we've always had a very invested group of medical advisors that have worked with us, and they're from a range of from surgery to very scientific to treating oncology, doing different types of research, different therapies that they might have been on a primary investigator for. And I think that they've always understood the necessity for working together and deciding is surgery better first? Is it better to do some sort of therapy before the surgery? You know, if it spreads, how do you manage that? How do you determine the next course of action? And by being able to have meetings such as this one, where we bring them all in the room together, I think that it not only educates them on what they might not have known, but it allows for them, I think, you know, if a surgeon asks a question to an oncologist, maybe you're not thinking with a surgical brain, and it can allow for something that might not otherwise have been thought of or researched. We'll be talking about obviously what's going on in surgery, you know, if there's new advances in the way that surgery is done, if there's adjuvant therapies that are happening with surgery. Again, talking about the current therapies that have been approved, if there's any new trials of combinations with these, and then again talking about some of the new therapies that are on the horizon and kind of what the pipeline for kidney cancer looks like. That with this meeting, you know, we always try to kind of cover the broad range of everything, let patients or let physicians know, you know, the best things that they could be doing for their patients. I know they're excited this year to have a session that's from a nursing perspective to talk about the toxicities, that's something that we hear all the time from patients is now they're on these therapies, but how do they manage these side effects and how can their doctors and nurses better help them with that? So I think those are a few of the key highlights for the meeting.